My name is Dr. Anu Diwakaran, and I'm a pediatrician with Cardinal Glennon Pediatrics at DePaul. When I was about 15 or 16, I had an opportunity to go to the villages of India and provide vaccinations through the Rotary Club. And I think it was at that point that I decided that I wanted to be a pediatrician. I saw the effect of preventive care and how profoundly it affects families, and we would go from hut to hut with vaccines on ice and try to convince these families to get vaccinated, and there was a lot of resistance to it. And then subsequently I worked at a hospital called Apollo Hospitals in Chennai, India after my medical school training, and that's after that experience I knew that I wanted to be a pediatrician. I spent most of my childhood actually in the United Kingdom, and then I came back to India for my high school and medical school at the University of Madras in Chennai, India, and then came to the United States and I did my pediatric internship at SUNY Brooklyn, New York, and then my residency at the Children's Hospital of Michigan. There's a comfort level that I bring because of these multiple cultures that I've been part of, and also I'm open to many different healing practices, many traditional methods of healing and we see patients from all backgrounds, ethnic backgrounds, cultural backgrounds, socioeconomic backgrounds, and I think there's a comfort level when they know that I've had that much training and that much experience and exposure. I was 7 years into practice when I had my first child, and when you are a pediatrician, you are trained quite extensively in child development and child discipline and all this advice that you're supposed to give your families. And once I had my own children, I realized that I didn't really know much. And I think my two daughters have really taught me many valuable lessons, and I've grown as a mother, but I've also grown as a pediatrician because I am a mother. And I think it gives you fresh empathy for your families when you see a mother come in and she's had a sleepless night with a baby and you've been through the same experience. Then there's a lot more understanding and compassion for the situation than just addressing the fever or the cough or whatever they're there for. I think the most important part of my job as a pediatrician is the responsibility I have towards making sure that the child is healthy, but not just physically, but mentally, emotionally, and spiritually. Because I just see that we have a generation of children that are in trouble. There's so many problems with obesity and mental health right now, and these children are the foundation for the future. So I think when I see a child in my office, I feel a sense of responsibility to make sure that I'm taking the best care of them as a whole child.
At Cardinal Glennon, our love for kids just keeps on growing.